Climbing stairs seems like such a simple thing. You have done it your whole life without thinking. And suddenly, at some point, you started noticing that you were holding the handrail more tightly, that you were looking at the step before climbing it, that you were waiting for your knee to get ready before taking the next step. Maybe you already avoid certain stairs. Maybe you prefer the elevator when you have the option. I hear this every week in the clinic. And the first thing I tell these people is, this has a solution. It is not just age. There is a very specific reason why climbing stairs has become difficult. And when you understand that reason, the exercises I am going to show you today make a lot more sense. Before we get to them, let me ask you a quick question. Can you stand up from a chair without using your hands? Try it now if you want. That answer will tell you a lot about where you are. And we are going to talk more about that in a little while. I have been a physical therapist for over 10 years, and today I brought 4 simple exercises you can do that will help you climb stairs with less pain and more confidence. Let's start with the one most people never associate with stairs, but that changes everything. Let me explain why climbing stairs has become difficult, because the answer may surprise you. Most people think the problem is the knee itself, the wear and tear, the osteoarthritis, the cartilage. But a study published in 2021 investigated exactly which factors determine the ability to climb stairs in people with knee osteoarthritis, and the result was clear. Muscle strength is more important than postural balance for climbing stairs in people with knee osteoarthritis. It is not how worn out the knee is, it is how much the muscle around it can still work. And here's the detail that changes everything. Climbing stairs is not just about strength, it is about muscle power. Power is the ability to generate strength quickly. When you climb a step, you need to lift your entire body weight with just one leg in fractions of a second. With aging and inactivity, that power decreases. The movement becomes slower, more hesitant. You start placing both feet on the same step before moving forward, not because you want to, but because the muscle is not responding fast enough. The good news is that muscle power can be trained at any age, and the exercises I am going to show you were chosen exactly for that, to build the foundation of strength and confidence your knee needs to face the stairs in a different way. Tell me here in the comments, do you practice any physical activity today? Or has knee pain already kept you away from it completely? I read every answer, and this helps me better understand what you are going through. One thing before we start. These exercises will challenge the muscle, and a challenged muscle complains a little. That is normal and expected. What is not normal is feeling a sharp pain inside the knee. If that happens, stop. Your body is giving you an important message, and it is worth listening. We do not want to make your pain worse. Always respect your body's limits. Exercise 4. Standing hip abduction. I am going to start with an exercise that, at first glance, seems to have nothing to do with stairs, but it has everything to do with them. When you climb a step, the gluteus medius, the muscle on the side of the hip, is responsible for keeping the hip stable while you transfer your weight onto just one leg. Without it working well, the hip drops to the side, the knee goes out of alignment, and the stairs become a problem with every step. Strengthening this muscle before any other one is the right place to start. To do this one, you are going to stand next to a wall or chair, just so you have support if you need it. Spine upright, eyes looking forward, feet parallel. Now move one leg out to the side slowly. About 30 centimeters is already enough. The torso stays completely still. Do not lean, do not follow the leg. Hold for 1 second at the top, feeling the side of the hip tighten, and bring the leg back with control. Do not let the foot hit the floor. Lower it with intention. I need you to pay attention to 2 things I see happen a lot. The first is the hip rising together with the leg. When that happens, it is the torso doing the work, not the glute. The second is opening the leg forward instead of to the side. It seems like the same thing, but it is not. If you place your hand on the side of the hip, you will feel the muscle contract when the movement is correct. Start with 2 sets of 15 repetitions on each side. When that becomes easy, and it will, place a resistance band just above the knees. It is simple, inexpensive, and it completely transforms the level of the exercise. Now, let's move on to the next one. Exercise 3. Sit to stand. I promised a question before explaining this exercise. And here it is. Can you stand up from a chair without using your hands? Try it now if you want. Cross your arms over your chest and stand up. If you manage to do it easily, great. You have a strength foundation that already puts you in a good starting point. If you needed your hands, or if you felt your knee complain, this is exactly where this exercise comes in. Climbing stairs requires lifting your body weight with just one leg. But before getting there, the body needs to be able to do it with 2 legs, with control, with confidence, and without pain. The sit to stand is that training. It is the most honest movement there is for building the strength the stairs are going to demand. To do this one, you are going to sit on the edge of the chair, feet flat on the floor, hip width apart. Cross your arms over your chest. This makes sure the legs are going to do the work. Lean your torso slightly forward as if you were going to give someone in front of you a hug, push the floor with both feet, and rise slowly. Once you are standing, stay steady for 1 second. Now the most important part, lower yourself back down to the chair while counting 4 seconds. Slowly, with full control. Land. Do not drop. I need you to pay attention to 2 things. The first is using your arms to push yourself up. I understand it is instinctive, but it takes all the work away from the legs. The second is dropping back into the chair on the way down, and it is exactly during the controlled lowering that the muscle gets stronger the most. Start with 2 sets of 10 repetitions. When that becomes easy, add speed on the way up. Rise quickly, lower slowly. This combination trains the muscle power that the stairs truly demand. Now let's move on to number 2. We are leaving the chair and going to the step. But take it easy, smaller than you might think. Exercise 2. Lateral step. Up. Here we start getting closer to the real stair movement. But with one important detail. Instead of stepping up facing forward, like you do on the stairs, we are going to step up sideways. And there is a very clear clinical reason for that. Stepping up sideways works the gluteus medius in a way the front step up cannot. It is the muscle that stabilizes the hip when the weight shifts onto one leg, exactly what happens with every step on the stairs. Before asking the body to do this movement facing forward with the full load, it makes sense to build that side stability first. To do this one, you are going to need a low step. It can be the first step of the stairs at home, a gym step, or even a thick, firm book on the floor. Stand sideways to the step, with the upper foot resting on it. Now push through that leg, shift your weight, and step up. Let the other foot come up to meet the first one at the top. Lower yourself with control, slowly. The upper foot stays planted the whole time, firm in the middle of the step, never on the edge. I need you to pay attention to 2 things. The first is leaning your torso to the side as you step up. When that happens, it is a sign that the glute is not handling the work on its own. Reduce the height of the step if you need to. The second is stepping up too fast without controlling the way down. The way down is where half of the gain happens. Start with 2 sets of 10 repetitions on each side. When you master the movement with the low step, gradually increase the height. That is the natural path toward the stairs at home. Now let's move on to number 1. And this is the most specific exercise of all. Exercise 1. Step up. We have reached the most important exercise, and the most honest one of all, because this is the real movement. It is stepping up onto a step from the front with your body weight, 1 leg at a time. But before putting you on a full flight of stairs, I need to tell you something I see happen all the time. People practice climbing stairs, on the stairs. And when the muscles are still not prepared, every training session becomes a source of pain and frustration. The secret is to start smaller than you think is necessary, and build the movement in phases. To do this one, you are going to use a low step. It can be the first step of the stairs at home, a gym step, or a thick, firm book on the floor. 4, 6 centimeters. It seems like very little, But that is exactly where confidence begins. Phase 1. Learn to step up with control. Start by working one leg at a time. Place your right foot on the step, push through that leg, step up, and bring your left foot up to meet the right one at the top. Step back down and repeat, always with the same leg leading. Do 10 repetitions on one side before switching. This forces you to feel the muscle on each side working independently, without compensating with the stronger leg. During this movement, watch the knee that is on the step. Is it pointing in the direction of your toes, or is it collapsing inward? If it is collapsing inward, reduce the height of the step and focus on alignment before anything else. Phase 2. Train the eccentric lowering. Once the step up is controlled, it is time to work on the way down. And this phase is where the muscle truly gets stronger. Step up with both legs if you need to, but step down with just one leg, counting 4 seconds. Slowly, with full control. Do 8 repetitions on each side, alternating. Feel the quadriceps and the glute holding your weight during the descent. This is exactly the control that will protect your knee on the stairs at home. Phase 3. Integrate the full movement. When the 2 previous phases are comfortable, controlled step up, eccentric lowering, knee aligned, no pain. Then you start alternating the legs naturally. Step up with the right, step down with the left, step up with the left, step down with the right. Do 2 sets of 10 total repetitions. This is the real stair pattern. And when you get here, you will notice that the movement has become much easier than it seemed in the beginning. There is no rush between phases. It may take days, it may take weeks. The criterion for moving forward is not time, it is control. When you master one phase without pain, without compensation, and without losing knee alignment, then you move forward, okay? Throughout the video, we talked about the hip and the knee, and that makes sense because they are the ones that show up in the pain. But there is a joint that works silently with every step you climb, and when it is limited, it transfers load directly to the knee, the ankle. Let me explain. When you place your foot on the step and push to climb, the ankle needs to bend forward. This is the movement physical therapists call dorsiflexion. If it does not have enough range to make this movement, the body compensates. And that compensation goes to the knee. It is one of the causes of pain on stairs that almost no one mentions. And it makes all the difference when it is addressed. To do this one, you are going to stand facing the wall, very close to it. Place one foot slightly forward with the toes touching the wall. Now push your knee toward the wall, slowly, with control, without lifting your heel off the floor. The heel stays planted the whole time. You will feel tension in the back of the leg, in the calf and ankle. Hold this position for 2 seconds and come back. The goal is to keep pushing the knee a little closer to the wall as the ankle gains mobility. I need you to pay attention to one thing. Do not let the heel lift off the floor just to get closer to the wall. When the heel comes up, the mobility is not happening at the ankle. It is happening at the heel, and the exercise loses its effect. 2 sets of 10 repetitions on each side. You can do it every day, even on the days when you do not do the other exercises. The ankle responds very well to frequent and consistent mobilization. We talked here about a few exercises. Did that scare you? Let me tell you how to use these exercises in your daily life, because the title of this video is not by chance. Stairs improve with consistency, not intensity. You do not need to do everything at once or spend an hour training. What works is doing a little every day, or almost every day. The standing hip abduction and the sit to stand can be done daily without any problem. They are light enough for that. The lateral step, up, and the step up demand a little more from the muscle. These work better on alternate days, 3 times a week. And there is one small thing that makes a huge difference. Every time you come across a staircase, stop for 1 second before going up. Breathe. Activate the glute. Step up with control, with the knee pointing forward. It does not need to be a workout. It needs to be a conscious choice. Over time, this becomes automatic. And when it becomes automatic, the stairs stop being an obstacle. I want you to remember one thing. Knee pain can have many different causes, and it is important that you understand this. What we showed here has an educational purpose, designed to reach as many people as possible. But every body is unique, every story is different, and a video cannot always cover everything. If your knee is in sharp pain or very inflamed, the first step is to see a doctor. They will understand the cause, make the correct diagnosis, and recommend the appropriate treatment, including medication if necessary. And for rehabilitation, to recover movement, strength, and confidence, that is the work of the physical therapist, who will evaluate you and create a personalized plan for your reality. Tell me here in the comments, what has the difficulty of climbing stairs already stopped you from doing? A trip, a visit, an outing you would have loved to take? And more importantly, are you determined to start making a change today? Write it down below. I want to know. And if you want to keep taking care of your body with simple, safe exercises designed for real life after 60, subscribe to the channel and turn on the notification bell. I left 2 options in the first pinned comment that can help you on this journey. The first is a complete exercise program, organized step by step, for you to follow at home at your own pace. The second is a natural supplement developed specifically for joint health and to help reduce inflammation. The links are there. In the next video, I am going to talk about the connection between knee pain and your spine. If this video helped you, the next one will complete the path. Until then, keep moving.